Well, good morning, everyone. For today's conversation, I'm joined by two colleagues from our Center for Child and Human Development. The center's director, now for more than 45 years, Dr. Phyllis Magrab, and Dr. Neal Horen, who leads the Early Childhood Division at the center. Phyllis is also a UNESCO chair and professor of pediatrics, and Neal is an associate professor of pediatrics. So Phyllis and Neal, it's wonderful to be with you both. And let's just begin. Phyllis, let me ask you first, share with us about the Center for Child and Human Development, your vision for the center, the work that it's been able to engage in over the course of the years, how you've grown this. What are some of the milestones or areas of work that you're most proud of?
Well, first of all, Jack, thank you for inviting us to be part of this. This is such an engaging series. I've really enjoyed watching it over the months. The one thing about our center is that I think it is so perfectly aligned with the Jesuit values of this institution, particularly the values of social justice, because our vision really is to build equitable and inclusive societies, particularly for children, vulnerable children and their families. And so the vision for the center is to use its scholarship, its training capacities, its translational research abilities to that end, to actually affect change in society that's lasting and endurable. And in terms of growth, so you mentioned how long I've been the director. I've been here even longer than that because I came as an intern, and we were a very small clinical program, as you well know, Jack, at that time. And so when I took on this leadership role, I did have a vision that we would be bigger than that we would address the cutting edge issues for equity and inclusion of our times through our research practice and ability to really transform policy. And I think we've done that. I mean, when I came, we had 2 grants. I would say now we have upwards to 40 grants, which it's not the number, it's what it allows us in terms of breadth and ability to accomplish. And so when you say milestones, so I'll take a breath and think back to the beginnings, and I'll maybe pick like a milestone for each decade. Sure. So in the 1970s, which belies my age a little bit, the thing I feel proudest of is that we were the second state in this entire country to close its institution for individuals with retardation and disability. And our center made that happen, quite frankly. We transformed the lives of all those individuals from living in that residential institution to moving them into community-based services. And to this day, we still are very engaged in sustaining sort of state-of-the-art community-based possibilities for these individuals. In the 1980s, there was a very well-known Surgeon General C. Everett Koop, and he and I became quite close friends. And he was very engaged in thinking about how we transformed care for children with special health care needs, those children that he as a surgeon was saving in the operating rooms. And so I really became his partner in starting a movement with our center around family-based, community organized, culturally competent services. And we changed legislation, both federal legislation and state legislation to achieve that. And to this day, families have been ever grateful for the way they receive services for their children with chronic diseases. And in the 1990s, I'll cite something that was in our global portfolio. George Soros, whom I came to know in odd ways, asked if we would partner with him and his foundation in the building of democracies in Central and Eastern Europe. And he had this vision, which we shared, that if you start with the youngest generation and build critical thinking and democratic values, you will be able to have sustainable democracies. And so to that end, we transformed early childhood education in 30 countries, and from there built on upwards a reform process in the schools that focused on critical thinking, which is kind of the foundation of democratic thinking. And then in the 2000s, late 1990s, we again were part and were really implemented and initiated a major movement around children's mental health, where at that point, any child with a mental health condition was pretty much stigmatized, and there were very few services available. So we worked with the federal government agencies in building what we called systems of care for these children, being able to keep them at home, give them services that they needed, giving families the supports that they needed. And for over 30 years, we've worked with states and communities to sustain this. And then I'll just end with the current decade. And I'm really glad Neal is here because I think our hallmark has been around building early childhood mental health services, particularly mental health consultation. And I am very proud to say that we really are the heart and soul of that movement. And Neal has been very much at the heart and soul of that movement. We currently have 4 major national centers addressing that. Neal is the director of those. And I'm just really glad that you have him here as well to speak. So I'll stop there. Maybe it was a little long.
Not at
But
all.
I've been here a long time.
Not at all. Thank you, Phyllis. And Neal, that's a perfect segue. Your area of focus is the social emotional development of young children. Could you talk about your work and the perspective you bring to working on early childhood issues? What is the center working on when it comes to these issues?
Sure. So in keeping with the theme, I also came here as an intern in clinical psychology, and I also have been here for a long time, not quite as long, but I think that maybe speaks well of Georgetown overall, that we bring folks in and they find a real passion and love. And as Dr. Magrab mentioned, a lot of our work over the last 10, 15 years is really centered on early childhood mental health, social emotional development of young children. And we've been pretty fortunate to pull in a number of national training and technical assistance centers. So these are centers that really address all the places in which young children live across the country, in states, tribes, territories, and communities, whether they're receiving home visiting services, they have mental health consultants coming to their childcare. We're part of a national center on Head Start, and then addressing children's mental health. All of these centers that Dr. Magrab described are our way of really ensuring that there's a system that supports young children and their families. We've done this work in the district, here at home, but we're also doing it nationally. We're actually doing it internationally as well. And that's sort of one large component of all the work that we do, is trying to address all the places where somebody's interacting with a young child: primary care, child care, Head Start, all those sorts of places. We then have another group of folks in our early childhood team who are doing all the research and evaluation around that across the country, and again, locally here in the district. And then we have a partnership with our friends in the Department of Psychiatry to ensure that our work here in the district is really fueling all the work that we do across the country. So it's really exciting because there's a huge emphasis, and I think this pandemic has certainly made us all aware of how critical it is to address the needs of young children and their social emotional development. So
I'd like to come back to the pandemic in a moment, but first let me ask Phyllis. I know the center's been focused on the mission of building equitable and inclusive societies, and in an earlier conversation in this series, I had the opportunity to talk with one of your collaborators, Professor Jen Woolard, and a new class that you've been working on together based on this idea. Can you share a little bit about this work?
So yes, Jack, that is such an exciting opportunity. Jen and Rachel Barr and several of us have been looking at collaborations between the medical center and main campus and the law school as well around childhood and society, so to speak. And we started with an experimental course, which was an excellent course, but was a little bit too experimental in terms of its venue, which were 3 one-credit modules. So we repackaged this as a freshman seminar and have been addressing, particularly through the eyes of young children and their families, what it takes to have equity, starting from birth and moving on forward. And we've had some excellent speakers, including Neal was one of the speakers in the class. We have a fabulous group of 17 or 18 freshmen who I cannot believe their level of sophistication. It's really mind-boggling. And we have just had the best time orchestrating this and look forward to doing this again. Jen and Rachel both are senior scholars in our center because of how closely and our work is aligned and how notable their work is.
Thank you. Thank you. Neal, let's come back to the pandemic. As we look at the impacts of the pandemic on our children, what are the kinds of issues that you're focused on, and what insights might you offer us as we think about the challenges our families are facing as they navigate this moment?
So, I assume that all of us spend most of our day talking about these kinds of things. First and foremost is that 4-year-old who's around the corner doing some virtual preschool right now, who will run in here at some point. But I think the kinds of things that are coming up at the national level are issues around how do we support sort of every single person in the mix. So how do we support children is about how do we help them understand grief and loss. There are children across the country who see an adult leave their home and then never see the adult again. And then somebody in childcare who's working with that child is like, how am I supposed to explain this to that child? So we've developed sets of resources to support those providers. They want to know, what kinds of behaviors might I see? What kinds of things should we expect children to do when we're starting to ask them to wear masks and their teachers are dressed like they are about to enter surgery with gowns and masks and shields and things like that? And so a lot of what we've talked about in terms of children and their families is how to even talk about all of this and help support what is, quite honestly, the first time that I've ever seen everybody in a disaster at the same time. We spent a lot of time running around after hurricanes and other disasters. Our work with the Office of Head Start and others nationally in disaster response and recovery has been a big piece of our work. This is the first time that everybody understands what it feels like to be in a disaster. And so it's not just for those children and families, it's also for all the staff who are working with them. And so this idea of how do we address staff wellness? And I've certainly seen some of the things that the universities put out for all of us as staff, but in terms of working with very young children, helping staff understand, how do I even do this? And how do we use things like Dr. Magrab mentioned mental health consultation, the idea of having somebody with mental health expertise who's there to support the adult. And I think of that as sort of PPE. That's personal protective equipment for staff, is to have access to somebody who can help them deal with the stress and anxiety of dealing with the pandemic for themselves, for their own families, and then in the work that they do. I was just on a call last night with a group of family childcare providers who are completely stressed out because they're trying to provide care. They're trying to figure out what to say to children. They're trying to decide, is it something I need to address if a child doesn't wear their mask all the time? These are 2- and 3-year-old children. So, a lot of this is about the grief and loss, but also just in a real sense, how do you handle a disaster?
Thank you. Thank you.
Yeah.
Phyllis, your work's always had an international perspective. I mentioned you're a UNESCO chair at Georgetown. Are there issues that you are particularly focused on as we think about the global impacts of the pandemic?
Well, interesting you asked me that question today, because just prior to this interview, came off being giving a lecture at a global conference actually on this very topic. And Neal has sort of raised what the issues are for families and children. And we were contemplating, how do governments, both national and local, respond to this? What is their responsibility, and what are the areas that they really need to address and consider? And, UNESCO, I've been involved with their learning cities and have learned a lot from other countries. We could, in this country, learn a lot from other countries about how they have handled this. And I would say there are 3 key issues that governments have to address. One is how to keep children healthy and nourished, whether you have emergency food delivery, water sanitation, hygiene programs, but that's a very critical global issue. A second is, how do you keep children learning? And one of the things when you think about young children is, how do you assure that early childhood learning is included in the distance learning plans that are being constructed by communities and states. And then when you think about, for instance, children with disabilities, how do you maintain in-home services for those children? And children who are vulnerable because of abuse and violence, those children actually need to be away from home and in a class setting. How do you distribute materials creatively through television, through radio, both adaptive materials and regular materials? These are all things that governments have to take responsibility for. And then the last third key issue that I would raise is, how do you protect children from violence and abuse in this situation? Because families are very stressed and very vulnerable. And so how do we support caregivers with coping strategies, with parenting strategies, with stress reduction activities? And then how do we train frontline workers to be able to identify and to respond when they see these kinds of issues? These are the things that communities, governments, and national governments are dealing with. And sadly to say, many of them much more effectively than we in this country.
I can't thank you both enough for taking this time to be with us today. In closing, may I ask you, is there a message that you'd like to share with our community? And perhaps Neal, we'll start with you.
Sure. No, I guess I sort of think of where we started this interview, and this sense that, you know, at Georgetown, it's about that we engage in the world and we're of service to others. And sort of, I've been here long enough that that's Dr. Magrab's word. It's an imprimatur on me. Like, that's just the way we do things. And I think as a community, the more we're connected, because I think we're all doing things to try and sort of advance what we know works, research to practice. You know, our director of research and evaluation would tell you that's what we try and do, is take research and make it practical. And I think as a community, what Georgetown can do is take all of the knowledge that we have in all the various ways and start to think about, how does that apply for everyone around? That question you just asked Dr. Magrab around that international work is quite honestly, a lot of what we have learned has applications everywhere else. And how do we sort of share that? It's been great to do some of the global health initiatives here at the university, where we've gotten to partner with folks from Arabic studies on a project in Lebanon and Jordan. And I think that those connections that we make really drive the work forward in a way that just enhances not just our work, but what's happening out for the rest of the world.
Thank you. Thank you very much, Neal. And Phyllis, is there a message you'd like to share?
Yes, I think that it's very important that we continue to be a voice for those whose voices are muted. And that certainly has been the way of our center. And through our scholarship, as Neal said, our outreach, our training, our advocacy, our moving things from scholarship to practice, we need to consider what we're facing in this 21st century. And we're facing things like racial and social injustice. We're facing things like climate change, the burgeoning of authoritarianism. And as we address these issues, I hope we never lose sight of the children and families as we move forward.
Well, with the two of you, I know that we will not lose sight of our children. And I want to thank you both for all that you do every day. And I want to thank you for taking the time to be with us today and for sharing your insights with us. And I look forward to being with all of you again soon. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.